listening to the Oral Health Podcast. Now, this is another bonus episode for you. We've got Karen here, who you've come to know and love, on BBC Radio Scotland, talking about Mouth Cancer Action Month. These bonus episodes are just some clips from all of the news bulletins that we've managed to get on over the last month to talk about mouth cancer. Just in case you missed it when it was live, this is a way for you to catch up.
A lack of access to NHS dentists could be costing lives, according to the Oral Health Foundation. They say that mouth cancers aren't being spotted or treated early enough. Figures from the foundation show that new cases of mouth cancer in Scotland are up by nearly a quarter. Well, Karen Coates is an oral health specialist from the foundation. Karen, good morning to you.
Good morning, Gary.
Tell us a little more about these figures, first of all.
Well, year on year, unfortunately, the figures are rising. We're looking now at 950 new cases of mouth cancer in Scotland each year. And if we compare that to 10 years ago, it's 22% rise. So that is quite significant. And, we're looking at people, 338 people in Scotland lose their life from mouth cancer a year, which is quite tragic figures, really, and obviously something that we would really like to, just educate people to the signs, symptoms, the risk factors, etc., and what they can do at home. Because, as you say, access to an NHS dentist can be very difficult during these times.
And I presume, like all cancers, the earlier it's detected, the better chance of it being treated successfully.
Absolutely, yes. The earlier we can catch it, the more of the patients that we can save. If the majority of cases, unfortunately, are stage 3 or stage 4 when they're actually diagnosed, which means quite complex surgery, often radiotherapy and chemotherapy. And unfortunately, mouth cancer is a cancer that you almost sort of wear because people can see if you've had sort of significant surgery. It affects the way you talk, the way you eat, the way you swallow. So there is a complete knock-on effect. And the earlier we catch it, the less complex the treatment needs to be.
And is this something that dentists are routinely looking for when you go for a checkup or some kind of work?
Absolutely, yes. Every time you go in for your checkup, be it 6 months, 9 months, 12 months, whatever your recall date is, it is something that dentists are looking for as a part of your dental checkup. So they will sort of feel underneath your chin, look inside your mouth, underneath your tongue, and on your palate and into the back of your throat as well. So if they do spot anything that they are a little bit suspicious about, they would refer you just to get it checked out, just to be on the safe side.
And what are they looking for? What should we be checking for? Because, sometimes you get lumps and bumps in your mouth, maybe you burnt your mouth from, hot food, or, you can get a little blister or something, or even sometimes, I know in the past I've had sort of like a blocked saliva duct as well, which caused a little bump there. And should we worry about these things? Should we get those things checked out immediately as well?
Well, if you know that you've had trauma to part of your mouth, I know you can get an ulcer from, maybe a sharp tooth or a sharp piece of food or something like that, or as you say, burning your mouth, then you kind of know that you're going to get an ulcer or a rough patch in there. But if it hasn't healed within 3 weeks, then you should be seeking help. And as we said before, if you don't, if you can't find a dentist, don't have a regular dentist, please go to your GP. They will be able to refer you as well. So anything that hasn't healed within 3 weeks. So we're looking for ulcers, red or white patches, any unusual lumps or swellings that are new to you, any persistent hoarseness of the voice, and the inability to stick your tongue out straight as well can be a sign. So any of those, don't hold back. Go and see somebody. If you can't see your dentist, see a doctor. They would rather see 30 people and it all be okay just to catch the one.
I wonder, would seeing a hygienist be good as well? Because an awful lot of people maybe can't get to see a dentist, but they can get in to get their teeth cleaned. Would a hygienist be able to spot something like this?
Yes, they would. Yes, a hygienist will be able to see anything that's suspicious. But, we can help at home as well. So we do sort of monthly checks for other parts of our body to note any changes or lumps or anything. So it's really important to start doing that with your mouth as well. So just once a month, have a look inside your mouth, lift your tongue up, look underneath, have a good sort of feel round with your tongue, look right at the back of your mouth. If you go to mouthcanceractionmonth.org, our website, it's sort of listed out, so it's easier to sort of follow it. So you could even print it out, put it in the bathroom, and then you can follow the sort of the pathway of doing it. And anything that's different for you really needs to be checked out. But don't worry, unduly, if your tongue doesn't look like your partner's tongue, or the underneath doesn't look like your friends down the road. Everybody's mouth is different, so just get used to what's normal for you, and then it's much easier to notice changes early.
Some good advice there, Karen. Thank you very much. Karen Coates, their oral health specialist with the Oral Health Foundation.
Thank you to Karen and for BBC Radio Scotland for having us and allowing us to talk about this topic that we're very passionate about. And thank you to you for listening. Please come back and listen to more episodes we've got planned, and we hope to see you again soon.